News Day continues here on One News Now. I'm Charles Lejano. Davao Region has received yet another batch of COVID-19 vaccines, but it is still unclear whether the supply will be exclusive for frontliners or if these will also begin vaccinating their senior citizens and individuals with comorbidities. Let's get more details from Gemma Vansenia. She's reporting live from Davao City. Gem, good morning. What do you have for us?
Charles, the fourth batch of COVID-19 vaccine allocated for Davao Region has arrived at the Davao International Airport this morning. 28,400 vials of Coronavac were immediately transported to the storage facility of DOH Region 11. As of this time, we are still reaching out to DOH 11's officials to confirm if the said vaccines are still allocated solely for medical frontliners here in the region who have yet to be vaccinated. This, as some areas in the country have begun inoculating the second and third priority groups, which include senior citizens and persons with comorbidities. In a virtual presser last week, vaccination team leader Dr. Janice Olavides said almost 50,000 of the more than 77,000 eligible health frontliners have already received shots. This means some 35% of health workers in the Davao region are still scheduled for inoculation. Olavides mentioned that more than 1,000 medical frontliners here in the region have deferred from receiving the vaccine due to health conditions. Meanwhile, COVID-19 cases here in the Davao remains manageable. As of yesterday, only 85 new cases were reported in the entire region, bringing the total of active cases to 869. Southern Philippines Medical Center's data also shows that as of this time, only 50% of their ICU beds and ward beds are utilized. Charles, here in Davao City, the LGU is currently focusing on the surveillance swabbing and implementation of strict health protocols. Davao City Mayor Sara Duterte said that this aims to mitigate the situation here in Davao City amid the COVID-19 surge in Luzon. Charles?
Thanks for that, Gem, and keep safe. That was Gemma Vansenia reporting live from Davao City. The vaccine expert panel is studying the possibility of mixing up vaccine brands to address supply shortage. If approved, Filipinos may be allowed to receive a different brand of vaccine for their second dose. VEP head Nina Gloriani said other countries are also considering this move to see if it can boost a person's immunity against COVID-19. However, Gloriani said they're only eyeing to mix vaccines with matching platforms like Pfizer and Moderna, which are both mRNA vaccines, or AstraZeneca and Sputnik V, which are both adenovirus vector-based.
Diba kulang din ang ating mga supplies. Sometimes you have to be realistic. Ano yung next na pwede ibigay? Hindi pwedeng i-delay too long yung second dose.
U.S. health agencies call for the temporary suspension of Johnson & Johnson's COVID-19 vaccine rollout over reports of rare adverse reactions. Reuters reports that 6 women under the age of 50 developed rare blood clots 6 to 13 days after receiving the Janssen shot. U.S. health agencies say this pause will only be a matter of days while they figure out the best way to diagnose and treat these clots. Meanwhile, Johnson & Johnson said they would delay its vaccine rollout to Europe. South Africa has also suspended the use of J&J shots. A health expert claims that patient-to-bed mismatch is causing the difficulty in securing hospital beds. In an interview with Sa Totoo Lang, NTF Special Advisor Dr. Ted Herbosa said there's a discrepancy between the available beds and the patients who need to be confined. He added that bolstering the one hospital command, quarantine facilities, and medical transportation may be the best way to prevent this mismatch.
Isa lang dapat maintindihan siguro ng ating mamamayan, pag pumunta ka kasi sa hospital, sa ER, sometimes may tinatawag na mismatch, no? Marami silang bakanting bed pero pang moderate. Pero kung ikaw ay critical at walang ICU bed, yun yung magmumukhang maghihintay or maililipat ka sa ibang hospital. So one hospital command, kasi kung saan ang available sa tamang bed para sa iyo, doon ka nila ilalagay.
Minimizing interactions between and among people and observance of proper health protocols are still essential in suppressing the rise in COVID-19 cases. That's according to Health Undersecretary Leopoldo Vega in an interview with The Big Story. He maintained that continuous suppression of the virus through application of health standards and COVID-19 testing has in fact decreased the R0. He added that the spike in deaths may be mainly due to cases involving elderly people.
definitely, comparing it with last year, there is a bit of an uptick. But it means only that the uptick could only be that this could be possibly be involving a lot of elderly people who have been contracting the virus. I don't think it is really that significant in terms of the mortality, since we have. I know the healthcare workers have already experienced, and they already know how to treat the COVID pandemic in terms of critical and severe patients.
Here are other headlines we're keeping our eyes on. All hospitals in Baguio are reaching the critical level as severe COVID-19 cases continue to surge. City Administrator Bonnie de la Peña said isolation centers in Baguio City are also 65% occupied. To decongest the city's hospitals, de la Peña said the LGU is now installing additional step-down care beds for oxygen-dependent patients. Over in Marinduque, the LGU has implemented a travel ban effective today due to rising household transmission of COVID-19. Only authorized persons are allowed to leave their homes, and they're required to present their RT-PCR or antigen test results. And those who have already received travel permits before the ban may still enter Marinduque, subject to strict health protocols. And Cavite has adjusted its curfew hours, aligned to what's being implemented in Metro Manila. Cavite, which is part of the NCR Plus bubble, will implement a curfew from 8 p.m. to 5 a.m. The LGU also noted that the 2-week ECQ managed to bring down their fresh cases to almost 200 per day from the over 1,800 at its peak 10 days ago. And when it comes to looking for ways to earn, Filipino wisdom knows no bounds. One example is this childhood hobby turned delivery business model. Gretchen Ho with the details.
Nakikita mo yun. Yung i-deliver ko, nakita mo na. Maandar pa.
Even beyond 8 o'clock, Ronnie is out in the streets of Quiapo, Manila to deliver this electric fan. His means of transportation? Well, it's not a bike, not a motorcycle either, but rollerblades. Ronnie said he picked it up from his childhood hobby.
Ngayon, yung nagkaroon po ng pandemic, wala po akong maisip na diskarte. Ngayon, sinubukan ko po mag-rollerblade. Ayun, hanggang saan po natuto po ako mag-deliver. Yung sa kung lugar.
Ronnie went viral last week with a shtick, which he aptly calls roller moves. Aside from delivery, Ronnie also offers pasabay. He purchases a customer's needs in exchange for a modest fee.
Pino-contact po ako sa FB, gano'n. Order muna po ako, tapos ngayon pag-order ko, abunawan ko po, pagbalik dito, yun, hanggang sa binabayaran ko po. Binabayaran po nila ako ng 30, 40, minsan dinadagdagan din po.
Ronnie fulfills 7 to 10 orders daily with his roller moves. Like many others, he lost his job due to the pandemic. He used to drive a sidecar to put food on the table and to provide milk and diapers for his newborn. He is now a barangay official on the side, but his stipend doesn't suffice.
Alternate po kasi yung pagiging pasok ko po sa barangay. Kataon pong pag wala pong pasok sa barangay. Ito po, yan, ginagawa ko po, mag-deliver.
His humility and grit to carry on was well received by netizens and even caught the attention of the initiative Donate a Bike, Save a Job. It gave him grocery items and upgraded his delivery service.
Salamat po ko. Binibigyan niyo pong tulong. Sana po meron po pa kayong ibigay niyo pong tulong sa iba tao. Grabe po yung binigay niyo. Salamat po talaga.
Donate a Bike, Save a Job hopes Ronnie can accept more deliveries, earn more, and travel farther and safer. Gretchen Hall, we are One News.
And those are the top stories of the hour. Join us again later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We're One News.